Chair, still on service delivery, issue of SHA. Chair, I have an experience of so many patients complaining of issues to do with the SHA network, especially on capturing biometrics. I had an incident at the referral where it took my patient more than 2 days for the biometrics to be accepted by SHA. So I don't know if it is a normal occurrence or because several patients, in fact I met one patient on the corridor shedding tears. And they were being told in case network is not coming, she has to pay cash. So was it a one-off incident or it normally recurs? And what can be done to improve on that now that recently the Cabinet Secretary for Health appointed, don't they are called county managers? You see, those are some of the things that need to be addressed that are really affecting people on matters health. And it trickles down to service delivery. So as the hospital management response, let them shed light on that issue of network of SHA. Watu wanaambiwa network imekufa hakuna. Thank you.
I think now we have that opportunity to clarify and also offer way forward instead of the areas that you mentioned.
Thank you, Chair. I take note of all the concerns that have been raised. Number one, let me start with the question on SHA. So SHA as an entity, remember when we started, Busia County Referral Hospital had a bed capacity of 280 in a paragraph. But then recently when the KNPDC revised its bed capacity, we were reduced to 149 beds. So that means that we are not able to hold all the patients on SHA when they come in for admission. And this does not only affect Busia County Referral Hospital, it has equally affected even the patients we refer for critical care. Because when you have a patient you're referring out of the county, an example of Moichi Referral Hospital, Bungoma County Referral Hospital, and UTRH Kisumu, the first thing is that they will tell you they do not have capacity to hold more SHA patients. Reason being that they've capped their beds such that you cannot expand. As a facility written to SHA, I mean to the KNPDC, requesting for them to come and do an inspection so that we can have an increment of the beds, but that has not borne any fruit. So when you come to the SHA network, it's controlled by the SHA system itself. As a facility, we may not be able to really work much on this, because at times, like, let me say 2 weeks ago, when SHA network really went down, we were not able to upload any documents, we were not able to have any biometric enter into the system. And this was equally not only for BCRH, but for the entire country, which the SHA system was worked on later, and we were able to admit more patients and were able to discharge. Then the issue about registration, or some patients come in, yes, they have the wish of having SHA pay the bills. But remember, the only time SHA is able to register you is when you put your biometric. So at any point in time, when you're able to pay, or rather you're able to activate your SHA, then you can use your SHA. If I came in as a client who initially was not on SHA, or had an inactive SHA, then I'm not able to use my SHA card at the end of it. So you get a patient who stayed in the facility for, let's say, 2 weeks. After 2 weeks, he registers for SHA. At that point in time, SHA will not be able to make their bill. Reason being, at that point in 2 weeks' time, already the bill is out. And the moment you put your biometric at that time, it will only be able to account for the bills that come after you've put your biometric. So most of the patients, by the time they're coming, they're not in a position to activate their SHA. Maybe because of the financial reasons that they may not be able to activate their SHA at that particular time. And those are some of the outcries that we usually get, but it's out of hand from the facility. As we start right now, Busia County Referral Hospital, in terms of SHA, SHA has been able to reimburse us about 83 million from the time when they started reimbursing her, but this has been cutting across since the year 2024. So when you come to the reality of the claims that we have, currently, what is active on the system are 50 million pending claims that SHA has not been able to reimburse her. And an addition of this is an addition of 22 million claims that SHA has rejected in terms of they are not able to meet criteria for validation. Then we have a total of 23 million that SHA tells us have returned them back so that we work on them and are able to return. We've been able to set up a team which is working on these claims. And the reason why we had a pilot of the claims is when SHA began as Busia County Referral Hospital, we didn't have the back rights to be able to work on the claims. So you get rejected claims, but then you're not able, you do not have rights to be able to tell reason why this claim has been returned or be able to work on the rejected claims. So you get that we have a backlog of these that we are not able to meet to be able to return back. And remember, the condition for SHA is currently, if a claim is returned and you do not work on it within 14 days, then it becomes obsolete, or rather it's written off from the system. You are unable to account for that. So maybe as a PAC committee, Busia County Assembly, we request that you assist us on that so that we are able to meet that. Then back to service delivery at Busia County Referral Hospital. Number one, service delivery cuts across. One being that we need to improve on our infrastructure. Remember FIF training just a year ago, or maybe if I were to be exact, around 1.5 years ago. Initially, it was being funded by the Exchequer, and the funds from the Exchequer were quite limited. So in terms of equipment, if you go back to the FIF Act, FIF is supposed to improve service delivery, but not in terms of ensuring that we have equipment or purchase of equipment. So for service delivery, initially you would look back. We used to have a plan. By the time you come to the facility, we give you a shopping list. We tell you we do not have a ceiling, we do not have a needle, we do not have a glass, we do not have ABC. But when you come to that, apart from the few improvements we've had, of course we also have the challenges that have been mentioned by the honorable members. Like the issue of stretchers and wheelchairs, a county referral facility has quite a busy place. So that you get patients being wheeled in, wheeled out. But recently we've been able to set aside funds which will be able to improve service delivery in terms of being able to acquire these wheelchairs and also be able to acquire the stretchers. So the wear and tear is quite on the higher side. And as much as we may say we have funds, we cannot say that it's adequate enough to be able to meet 100% needs for the facility. But all I can say is that we are on the course to improvement, and I'm sure very soon we'll be able to be happy with the services that are being offered.
Yes, that's a bit of almost near lecture, but I hope members of quick critical clarification. Yes. Let me get from honorable member, and then we'll get away from how we need to get that input from members' accounts so that the parties represented here. Honorable, okay.
Thank you, Chair. Once more, Honorable Purple. And I really want to congratulate Dr. Nonlana. You know, you're very good at articulating issues. How I wish you could implement that in our hospitals. You can really put things, arrange your words correctly, perfectly, in order, but when it comes to implementation, that is where you talk about. You are the medical superintendent at Busia, but I've been with you for like 4 or 5 meetings. You are ready to work perfectly. You say it with a lot of vigor, with passion. Can you also be passionate about Busia people the way you're passionate when you're articulating issues? Because we are lagging behind. If only what you say can be put into practice, Busia can be a very healthy county. I'm begging you, not as an honorable member, as a woman, as a mother, as a member of this county, can you translate that, what you are saying, back to the hospital? I met you during the Senate. Perfect. You gave them all the explanation that they needed. But when we went to the ground, things totally different. I don't know why. Is it because some of you maybe own your own hospitals, you don't care about what is happening at the PCIH? We were even told that if the doctors are running pharmacies and to get there, they should be closed. Is it because you want to be far so that you can be able to make your daily bread every day at the expense of patients? You know you have a lot of knowledge. You are qualified doctors. Can you be passionate about Dr. Busia? I'm a manager Busia. I don't want to go to nowhere sharp because you know the experience for you to do the hospital. I lost my cousin. And I came to your office begging you, Madam, this is what is going through. I had to walk in that hospital every day, telling you the problems that we had in the hospital. But what did you do? Nothing. It is just like the government inspector. When you knew that the Senate was coming, you ran around doing things, putting things in order. We might be blaming the governor, but you people are the ones blaming this government. I don't know because you're other PNP, because this is not your county. Sometimes I tend to think that because maybe some of you don't come from this county, you want to do things the way you want. I have just received a message here. Port Victoria. Do you have a generator? Port Victoria Hospital. A patient has died, there's no generator, there's no electricity. I have a message here. A man by the name of Busia. He died because when he was rushed there, there's no generator, there's no power, and he needed hospital. Nonetheless, I'm just begging you, kindly, all of us who are here, let us talk the walk. We're just talking, giving us stories that are not going to help us. We are not being judged outside there. Or, let me finish this. We are being judged everywhere. We are not doing, I'm in the health committee chair. So if I'm talking, I know what I'm saying. I'm in the health committee. And things are worse. People should not like you here because this is a committee. We are an embarrassment. Imagine now if we are going to present ourselves before the Senate. What kind of embarrassment do we be able to get? The auditors general are doing their work. But again, our lives are at stake here. Busia County is lagging behind because of you and me. We are trying to do our oversight work, but you people are late. You are late there. Not because you don't love Busia, because you are selfish. All you think about is, oh, my clinic, my pharmacy, how am I going to be fast so that I get my commission. If only we can concentrate and be passionate on what we are saying here. The issue of share, sometimes you go with a patient, the queue is very long. Even the other day, I start to get other people so that we serve people very fast. The other day, we used to have a service chat at the hospital. Ugandans, Kenyans to Kenya. Is it still ongoing? Really? People come with ideas, they buy people here, they take ideas, they go and pretend they're Uganda, they're Kenyans, and they're treated. So please, can we just work for this county? I'm sorry, I think please, can we just put Busia at heart? Let us love Busia. If you love your county, you will serve people passionately and we move forward.
You guys come
Thank you.
now? Okay, good. Members, I think you will have to give a contribution. It is a very emotive matter. Not that because we are trying to express we are representing people. And we are talking for the people. And as legislators, we have to inform the directions of positive political action. Yes, Honorable, kindly members, we can do summary.
Chair, you are very right. This issue is very emotive, and that's why you see members raising their hands actually to react on it. Chair, health is wealth. And this is the reason why Busia County, we are still being counted amongst the poorest counties in the country. And health is contributor number one to where people are poor. Chair, the issue of FIF has been mentioned adversely in all these reports. And there is a question that an honorable member asked here about how FIF is working And I can see the auditees are avoiding that question. Remember, Chair, we are the ones, this assembly is the one that passed that document. And Chair, there has been allegations that whatever we pass here is not what is being implemented on the ground, Chair. And I think that's one of the reasons why we are getting all these problems, that money is being collected and is not being spent, Chair. A question was asked to the Chief Officer Health to explain to us step by step how FIF is working in our hospitals. That question has not been answered, Chair. And it is really a concern. We want to know whether what we pass here is what is being implemented on the ground. Thank you.
You are still trying to catch my eye on the Bomalwa. Last one that I want to provide them an opportunity to answer you.
I give my comment after the chief.
Also,
as
we need an opportunity.
yes, that's why I also give my submission that allow me to give my comment.
But you are not predetermined what the Lord said.
No, Chair, you see, we have asked that question.
Let him let him answer. That's what I would say is, I was given an opportunity to answer. And you got my eye,
Yes.
you want to ask.
And you mentioned this, that's why I'm also trying to respond to you.
You are directed on Bomalo.
Thank you.
I think we don't want to lose track. And let's provide answers for queries and ask, because they're related to budgetary control and performance. And is closely associated, related to the interventions the department is taking, among others, to improve services and increase revenues. So I want to give, Chief, we will take that query in terms of the issue of FIF. And I was also going to look, I have the act here, and I was going to look at the implications we just, when Mohammed mentioned. Precisely, briefly, you can shed light on that. Then others, I don't know what Victoria did mention, is it what Victoria's your vote? What Victoria? Because they've been last mentioned, we'll give them an opportunity to say something. But after Chief has been able to explain. Chief, maybe let's proceed. We still have two issues cross-cutting that are yet to be disposed of. Chief Officer of the department.
Thank you, Chair. Ideally, the Facility Improvement Funds Act declares an entity, declares facilities to be entities of their own. And by that, it allows you to do your plan for your resources, collect the resources, manage the resources, retain the resources, and then spend the report of what you've actually spent. Now, for our FIF, that means every facility has been mandated to actually create a board. Every facility has been mandated to establish what we call a health management team. The work of the health management team is to actually prepare budgets. They do prepare budgets, and then they forward this budget to the health management board for approval. After the board has approved those budgets, they are now allowed to go and implement. They do requisitions to the chief officer, requisition for approval of AIs. Once they get this approval, they are allowed now to go and spend as per the budget that have been approved by the board. In chair, we will have reports and we will have records to confirm that this is what we will do. Thank you, Chair.
Yes, Honorable Omando.
Yeah, I think What Chief is answering is what is already we have it here. Because it is in the FIF. In fact, it's telling us what we already did. My concern was money has been collected in a level 3 or 4 hospital. How is it being distributed? Because it is, there is a way that money needs to be distributed. Leave about, let me start from level 1, level 2, level 3. How the money has been collected, yes, it is in that account, yes, and that's the question. These are the things we know. But on only that matter is where my concern is.
I think that is in relation to the act that was passed. Section 9 of that act talks on retention and utilization of the health facility improvement financing. That's what everyone was asking, and I think is in my description of the definition of the facilities that we have from level 5, from level 1 to level 5. I don't know if we have level 5 in this county. Part 2, or section 2 of that regulation is that all the money is collected and retained by the health facilities. As that section 1 has given the description of these facilities, 70% shall be retained and utilized at the county and sub-county hospitals, and for public health services, 25% of the money collected shall be utilized for primary care, and 5% shall be utilized for administrative expenses. What Omar is asking is that what is happening in our facilities or the money that's being collected? And if not, why? If yes, is there proof? Yes, then 2, the query I was going to ask or to add there is part 4 of that. That the county executive member shall prescribe regulations on utilization of the monies retained for the purposes of supporting the county health management team and the sub-county health management teams, which are represented here. We have the regulations in place that are supposed to regulate this particular fund. The regulations that are supposed to be developed by the CECM hub, who happens to be His Excellency the Deputy Governor. And now the Chief Officer, I said, is presenting. So I hope he's in position to answer that, and then we move forward. I want to give the Director Officer your coach. Your coach is becoming Port Victoria. No, the Chief is finishing that. I'm just beginning that. Chief, you can do that clarification. What is happening and in relation to that regulation?
Yeah, Chair, I wish to confirm that yes, we do follow that regulation. Around 26%, around 26% normally transferred to CHMT, and then around 74% is normally retained by specific facilities. And we have records to confirm that. Thank you.
Is that in concurrence with what I've read? Chief, is it in concurrence with what I've read? You saying 20? I have your answer, just for clarification. I think she missed mine. You said something about 20.
It's around 26. That is normally transferred to CHMT, and then around 74 is normally retained by the hospital.
I'm getting here what is the law. It's 25, then 70, then 5. So, yeah?
If you look well, the 5 is normally shared. It's shared between what is transferred, what is retained by the facilities, and what is transferred to the station.
So are you confirming that you agree with the law?
No, we could
I know.
Can you quote, I have the act here,
Yes.
as Primary County Assembly, and specifically Section 9, that I'm reading. Maybe legal officer, can you, this is the law, maybe the other provision of the law that I don't know, that are not included in this act, but I've read what's provided for the act. So 26, 72, 74, I don't know, in 2 point. Maybe can you confirm? You have the act, you have the act, can give you one that could read for us whether that particular section is. And I think this is confirming what Omar was asking in terms of compliance with the law.
Yes, Chair.
Just the assistant which section you are referring to?
Section 9 or Section 2?
Yes.
And I would want to read the particular section.
The same that I read?
Yes. So that we get it here.
Maybe my ID is you. Okay. Let me allow the legal officer, because the one that I don't read. Can you read that section, the legal officer?
Thank you, Chair. I'm going to read that in Section 9, Section 2. Of the monies collected and retained by the health facilities at Section 1, 70% shall be retained and utilized by the county and sub-county hospitals.
Stop there. It is 70%. 70%. Proceed. I'm not ignoring. We are seeking legal.
Same page with you.
Okay. What is it called?
You know, the chief officer is telling us of 26. Now, let's read what we have as a document, as just the legal has just read. Then let him also read what he has, and let us compare. So that we will have two documents here.
Unless you are thinking otherwise, because what I've directed the legal officer to do is the same thing you're repeating.
No, Chair.
Order.
We have a document on our side, and the chief officer has a document on his person. And he read his own
The
document.
legal officer is here.
It's not their legal. This is our legal. They are also their legal. Just from there.
The committee operations are guided by law, and that's why you have a legal officer here to give us direction whenever we need that guidance. Legal officer, read that section.
I will prove that the 6% is written.
Let's allow the legal officer to read. Then I give you members an opportunity to contribute. This is your meeting. I'm only providing leadership. Proceed.
Thank you, Chair. So, 70% shall be retained and utilized by the county and sub-county hospitals and for public health services. 25% of the money collected shall be utilized for primary health care, and 5% shall be utilized for administrative expenses.
Now the chief officer will read your version.
Chair, I think
Just proceed.
it's the same motion.
Be on answer, please.
Sorry, Section 2, just the way